permitted. So if changes are not consistent with existing law, a waiver is required in order to receive those federal matching funds. And remember I said that the matching funds are the Fed's part of paying our Medicaid bill. There are basically two types of waivers for us to consider. There are program waivers, and the numbers for those are 1915B or 1915C, and those are related to managed care and home and community-based care, and I'll go over those in just a moment. And the other type of waiver are 1115 waivers, and those are research and demonstration waivers to allow experimentation or testing of a pilot program. So first, 1915 waivers. So 1915 waivers allow states flexibility in two areas. Managed care enrollment, and that's a 1915B waiver, and eligibility for home and community-based alternatives to institutional care. And then that's a 1915C waiver. And I'm guessing that is the waiver that most of you are most interested in, because that's the waiver that DDS uses to maintain services at home for people with developmental disabilities. Those are the waivers that are used, home-based care that's meant as a substitute for long-term institutional care. So we'll come back to those in a few minutes, but that's really the one I think you're thinking about. But it's good to have a sense of the rest of them as well. So the 1915 waivers are used to control Medicaid spending without increasing costs to the federal government. Here's another little rub about this. You can't ask for the feds for any more money as part of your waiver. What you ask is permission to waive a Medicaid rule and use your same amount of money more efficiently. So in the case of home and community-based alternatives to institutional care, Medicaid would otherwise be paying for someone to be in an institution. If you get a waiver for them to allow them to be cared for at home instead, we all know that that's oftentimes better for patients and their families, but it can't cost the Medicaid program any more than it would have cost them if the patient was in an institution. That's a Medicaid rule that you cannot spend more. You can't increase your costs. So, first waiver, a 1915B waiver, is often called a freedom of choice waiver, as it exempts states from mandates that recipients have a choice of providers. So what one of the Medicaid rules says is that everybody in your state who participates in your Medicaid program, or Medi-Cal in our case, has to have freedom of choice in terms of providers. Now, if you want to start to enroll people in Medi-Cal managed care, you take away some of their choice. So in order to be able to have a managed care plan, you have to ask for a waiver for that rule related to freedom of choice. So when you ask for a 1915B waiver, you're typically asking for a couple of different kinds of rules to be waived. One of them might be statewide-ness. So Medicaid says that your program has to be the same throughout your state. But if you're trying to implement managed care in, say, Los Angeles County, then you have to ask for a waiver to the statewide-ness rule that says that LA County can use a different model than is allowed in other parts of the state. The second is waiving comparability of services. And this allows the state to add services to the benefits package for certain individuals. You can't take away any services, but you can add. So for instance, if you're moving people into a managed care plan, maybe you'd like to add a case management component to that. And that managed care plan with the case management component only exists in San Francisco County. So that wouldn't be comparable throughout the state. You have to waive, you have to ask permission to waive the rule about that. Choice of provider is another rule that has to be waived. For those in managed care, Medi-Cal clients in managed care have to be provided a choice of at least 2 health plans. But it's not like fee-for-service Medi-Cal where you can take your Medi-Cal card and go to any provider you'd like to see. You have to use the providers that are within the health plan. And then the upper payment limit rule, which says that managed care can't cost more than fee-for-service. So the idea with the 1915 waiver is to waive some of the state rules related to the Medicaid program so that you can try other models of care. So let me stop now and see if anybody needs to unmute and ask any questions. Okay, so I'm going to go on. Now, a 1915C waiver is, I'm guessing, the one that most of you are most interested in. So this is known as a home and community-based services waiver. And it allows states to treat certain Medicaid populations in home or other community-based settings rather than in institutional or long-term care facilities. Created in 1981, so they haven't been around forever, and they are for individuals who would be Medicaid eligible if they were in a long-term care facility. Say you have a child at home who is technology dependent, is eligible to move to a long-term care facility, and as a result of moving to that long-term care facility would become Medicaid eligible. Well, you don't really want to move them out of their home where they're cared for just so they can become Medicaid eligible. So this asks for a waiver to the rule that says you have to be in a long-term care facility in order to become Medicaid eligible. It allows kids who would not otherwise be financially eligible for Medicaid to be eligible in order for them to be able to remain at home. So eligible populations include the elderly, disabled, the mentally ill, developmentally disabled, or mentally retarded. This also allows states to cover services beyond the scope of traditional Medicaid benefits to cover additional medical and non-medical services. So, for instance, it might offer some additional nursing hours in order to keep that child at home. Maybe the parents can keep the child at home if they can care for the child 8 hours out of 24. But they need to have 16 hours of nursing care in order to do that. So this would allow the state to cover that extra expense. And it might cover some other services, such as case management, personal care, homemaker care, in-home support services, additional in-home support services beyond IHSS, transportation, some environmental modifications, etc. So the rule that you're asking to be waived in this case is the rule about income and resource standards, which requires states to apply the same income standards throughout the state. So throughout the state, if a family makes over a certain amount of money, their child is not eligible for Medi-Cal. But if the alternative was to put that child in a skilled nursing facility, the state has asked permission to waive the income and resource standard rule for that child in order to allow the child to remain at home. The state's waiver for this particular kind of waiver, the state has to specify a limit or cap on the number of recipients who are eligible. And let me tell you what the cap is for this year. For waiver year 09 and 10, the cap was 90,000 people. For 10, 11, 12 waiver year, the cap is 95,000 people. So there is a cap on this, which is sometimes why there's a waiting list. Someone is waiting in an institutional environment to be able to go back home because of this cap on the number of people who can be in a waiver, in addition to the length of time it takes to pull together all the justification, the medical justification for a waiver. So typically this is for a specific population, individuals with developmental disabilities, physical disabilities, or seniors. Any questions about that kind of waiver before we move on?
I have one.
Yes, please.
I've heard the phrase institutional deeming. Does that have to do with what you just explained, or is that a separate thing?
No, that has to do with what I just explained.
Okay, thank you.
Other questions? So 1115 waivers, these are research and demonstration waivers, and they provide exemptions from a wider set of Medicaid regulations than the 1915 waivers do. These allow states to experiment, pilot, or provide demonstration projects. So, for instance, Los Angeles County has an 1115 waiver right now. Let me see if I can find that for you and give you an explanation of it. Basically, what that waiver, the LA County waiver, is about is providing additional funding some of the hospice-based services to community clinics in order to provide more cost-effective services. So for those of you who are familiar with LA County, a couple of years ago, the county health care system was in bad shape, as it is again. But there was some extra federal, there was a waiver for moving additional money into the safety net clinic providers. We have something called a public-private partnership now where county patients can be seen in clinics in the community as a result of this waiver. So the purpose of these 1115 waivers is to allow different states to experiment with different ways of delivering services. They can be used to waive a broader set of Medicaid provisions as long as they are budget neutral. And remember, I talked about budget neutrality before. The feds are not interested in spending any more money than our approximately 50% match to our state. But they are willing to waive the rules so we can use it in different ways depending upon how we'd like to experiment with the money. So it can be used for such things as altering the benefits package, extending coverage to new populations, expanding eligibility, developing cost-sharing requirements, and creating lock-in periods. Certain things are not allowed, for instance, limiting services for pregnant women and children. The Medicaid rules are very clear about services for children, and they can't be altered to any great degree, and imposing certain cost sharing and changing the federal match rate. So we can't apply for a waiver to change our match rate from 50% to something else. It is what it is. So these are some current 1115 waivers. The Family Pact, which is Family Planning, Access, Care, and Treatment Program. And this allows federal reimbursement for reproductive health services for medically indigent females and males. Focuses on outreach efforts at adults at or below 200% of the federal poverty level who are at risk of unintended pregnancy. The program provides pregnancy prevention services, including contraceptives and sexually transmitted disease prevention services and education. So this was a request of the feds to use our Medicaid dollars a little differently to fund this family planning program statewide. And another example is In-Home Support Services Plus, and this provides aged, blind, and disabled individuals an array of self-directed personal care assistance and delivery options that are not available under the Personal Care Services Program. This Independent Plus waiver enables recipients to remain in their own home or family home. So you can see that the purpose of these 1115 waivers is to allow some experimentation, if you will, in the way services are delivered. There is a requirement with 1115 waivers provide data. You actually have the state actually has to conduct research and provide data to the feds that they've accomplished something by way of this 1115 waiver. It's not just throwing money at the state and allowing the state to do whatever they want to do. There's actually some accountability back to the feds. Some examples of 1915B waivers. There's an intermediate care facility for the developmentally delayed. This is a pilot program to test a new licensing category that provides continuous nursing care to medically fragile, developmentally disabled beneficiaries in the least restrictive environment. And then there's the Specialty Mental Health Consolidation Program. Some of you might be more familiar with this waiver based on delivery of services, and that is to allow all Medi-Cal managed care mental health services to be provided through county mental health plans, as opposed to people being able to take their, as opposed to having to go through individual managed care plans for their mental health services. So the mental health money was taken out of Medi-Cal managed care plans and given to the county mental health programs so that the county mental health programs could operate the mental health programs as opposed to people getting their services through their health plans. So those are two examples of 1915B waivers. And then some examples of 1915C waivers, and I know a lot of you are familiar with this one, the Home and Community-Based Services waiver for the developmentally disabled, where they are getting home and community-based services as opposed to being institutionalized. And in-home operations, which requires services by a licensed nurse. So this is a child who's ventilator dependent in the ICU in the hospital, could really go home if there was enough resource available so the child can receive Medi-Cal eligibility and then have care provided for at home.
So they wouldn't have to be a Status 2 regional center client for that that in-home operations?
Operations is more medically oriented.
Right, so for kids who are not regional center but require...
Correct.
Okay,
correct. Maybe
great.
the child has
we just encountered that, so...
Yeah.
Okay.
Okay. So how does one apply for a waiver? The first thing is the client has to apply for Medi-Cal. And I just chose the two that I thought were most relevant to you, the In-Home Supportive Services Plus and the Home and Community-Based Services Waiver. And you can see that the first one is done through your county social services staff. The second one is done for those with developmental disabilities through their regional center. Let me get to the next slide. If you go to the website, let me see which one it is. The one, what are Medi-Cal waivers? There'll be a page on that website that says description of Medi-Cal waivers chart, and you can actually click on each of the waivers, and then you get very specific information on those waivers about how to apply for them. So if you click on In-Home Supportive Services Plus waiver on that website chart, it'll tell you the type of waiver, the eligibility requirements, what services are provided, what the funding source is, what the enrollment cap is, what the waiver term is, and then links for any additional information that relate to it. So it's actually a very cool website if you're looking for very specific information about a waiver. This first resource provides you some general information about Medi-Cal facts and figures. And then this one here is a general overview of waivers and some additional definition information. Whoops. So that's the basic overview of waivers. So I'd like to open it up now to some specific questions that you might have. And those questions can be about Medi-Cal generally, about waivers, whatever you'd like.
And we print out your PowerPoint. How do we do that?
I'd like to correct that one. As far as I know, you can print out the PowerPoint, right, Tara?
I don't know if participants are able to print it out, but directly. But
you're going to send it out, right?
Yeah, I'll email it out to everyone.
I'll send it to you. I'll correct that one slide that should be 14% instead of 16%. And then I'll send them to Tara, and she can get them out to you. And you can forward them on to anyone you'd like. I have no problems with you sharing these.
Thank you.
Kathy, can you hear me?
Yes, is that you, Juno?
Hi. Oh, this is so
Hi,
weird.
how are you?
I'm talking to my computer. It's so Anyway.
Okay, that's kind of weird, but all right.
So I may have missed this, but the waiting list, is that for the DD Medi-Cal waivers as well as the nursing waiver?
I can tell you, let me just get to my notes here, and I can tell you what the numbers are for each one of them.
So there's a cap on the...
Yes, there's a cap. So for the intermediate care facility for the developmentally disabled continuous nursing, that one, oh, that's the pilot program. Let me get to a better one for you. Okay, in-home operations, that's the nursing one. That cap is, let me see, for calendar year 09, that cap was 210. Yes, you heard me correctly, 210.
So
for the DD waiver, it's 90,000 this year.
So when we're thinking about family voices and stuff, 210 is probably ridiculous. And
yes, it is.
Who sets what are the parameters about setting a cap?
It's all budget.
So they say we only have this much money, so this is what we're going to do?
Yes. And when they apply for the waiver, they say how big the waiver is going to be.
Do we know how many people, or is there a way to find out how many people are on the waiting list for that waiver?
That's a good question. I guess we'd have to check with one of your buds in Sacramento to find out how many people are on the waiting list. But I suspect, you know, if you only got 210 spots available, I'm guessing there are quite a few people on the waiting list.
So, Tara, I would say for Family Voices that would be a great thing for us to find out is how many are on the waiver, how many are on the waiting list for both of those.
Okay.
We were just told that it was about a month waiting list for a family we're working with.
For the nursing waiver or the DD waiver?
For the nursing waiver. For the home, what do you call that, in-home operations waiver, it was about a month.
Well, that's good.
I don't know. I mean, I heard it was a lot longer, but the CCS nurse that we're working with said it'll be about a month, which is a long time for the family, but
of course.
It's not getting any sleep. But
no, that's in other states, they're like 8 years waiting lists.
Exactly. Usually it's quite a bit longer than that.
Well, that's what I was surprised by, but we'll see.
If you're saying a month, I say hooray to the family.
Kathy,
I don't know. I mean, they don't have it yet, but that's what the nurse told us. So that's what the CCS case manager, nurse, whatever, told us. And there's no triaging though of those, right? I mean, it's first come, first serve.
Well, to a degree, yes. I've provided documentation for IHS for nursing waivers for kids who have been, in an ICU waiting to go home. And it's after all the documentation went in, it still seemed to take a couple of months before the application was approved, and then, of course, getting all the equipment and things set up.
Is there a way to find out how many kids are stuck in the hospitals waiting to go home?
You know, you do the in-home operations waivers through the Medi-Cal field office. So it would probably, I mean, if the family is waiting to know, it seems like it would be reasonable to call their particular field office and ask, you know, where are we looking on the waiver here, and, you know, are there people ahead of us? Are we really going to get a spot soon?
But also, is there a way, Kathy, to find out the numbers of people within hospitals who are waiting?
I don't know that, but that's something that would be worthwhile looking into.
Well, here's a one-of-a-kind question that happened to one of our families, that somehow Medi-Cal switched them from the DD waiver onto regular Medi-Cal, even though the family wasn't eligible for regular Medi-Cal.
Huh.
And we tried puzzling it out and trying to figure out how to get them back. But
there's been no change in family income or anything like that that would have made them.
No, it was just they came upon it in an odd way, and then it's like, how do we switch it back because we're not eligible for regular Medi-Cal, and who made the switch? And
well, that sounds like maybe some kind of clerical keystroke error.
Yeah.
Well, they should probably fess up soon so they don't get any billed for anything they shouldn't have been.
Well, CCS claimed that wouldn't really affect them and they shouldn't worry about it, but it just sort of seemed like an odd...
I'm not sure why the entire family would be found
No, just
to
the
be
child. Just the child was put onto regular Medi-Cal instead of the waiver. He'd been on the waiver for years, and then, like 2 years ago, someone made a switch, and they just found out about it. Okay. No one else has that? Okay.
Kathy, I have some questions written down from people. One is there a downside for parents to apply for the home and community-based waiver for their child if they have primary private insurance?
Oops. Was that a question? I'm sorry.
Yeah, it's is there a downside for parents to apply for the home and community-based waiver for their child if they have primary private insurance?
Probably not, because first of all, their private insurance is going to max out at some point. There might be some complication related to getting denials from the private insurer, but generally one can work through that.
The other question we have from David is, he said about halfway through the presentation you mentioned transportation, and he wondered what types of transportation are being referred to.
Non-emergency medical transportation. So, for instance, somebody who needs to ride an access van to go to their dialysis appointment.
Those are all I have for the typed-in questions so far.
Any other questions?
I have one. This may be answered on one of those websites, but I haven't opened any. If a parent of a child with who's a regional center consumer wants to apply, is it best to go first through the service coordinator or to just do it on your own?
No, they need to. Those applications need to go through regional centers, so they need to start with their service coordinator.
Okay.
I have one, and I'm not even sure how to ask this. I got a call last night from a friend whose daughter has in-home support services and Medicaid. And, you know, we're being sent those forms quarterly.
Yeah.
And she says on her form they ask for income of other people who are in, this may be way too specific, but anyway, ask for income of other people that live with the child.
Right.
Does she have to fill that out, or can she just leave that blank and just keep going?
No, suppose that's a personal decision on her part. The idea, of course, is to find out if there's any other income in the home that helps to support the child. So, you know, maybe she's living with someone who is fabulously wealthy and pays all of the rent every month. Then theoretically there would be more resource available for the child. So that's what they're trying to get at. Are there other people living in the home who help provide support to the household?
What if they, what if the person...
Might it be used against her? I would think so.
And what about if they have, like, well, oh, never mind, feelings about that. But what if the person just sold their house and they're planning on buying another house, but so they have this money that's there right this second, but they're... Would they
now I think that's probably a problem. Because you're allowed, you're allowed a house, but you're not allowed a big pot of money in a savings account.
But her daughter is separate from her? Like she's an adult? She's 18?
So she's emancipated anyway.
Oh, okay, so there we go. If she's emancipated, it would be different, right? But aren't you eligible because you're through your disability as opposed to financially? That's where...
Yeah, but remember, you'd be eligible if she was under 18. She would be eligible. She could be eligible by way of, being at home versus institutional care. But now that she's over 18, she would be an adult, and so she would be looked at independently as an adult.
Oh, this is really complicated. But yeah. So if you're an adult...
Did she recently turn 18? Is there some lack of awareness about that, and that's why they're asking for family resources for her care?
But even if she... Okay, so if she's, let's say, institutionally deemed, she's institutionally deemed because she has a disability. So I would think that her family's income shouldn't make a difference. And if she's over 18, it shouldn't make a difference because she's an independent, she's an adult.
Correct.
So it's so bizarre that they're asking for that. I mean, I get why they would, but I don't understand why families would have to answer that.
Yeah, well, she could probably take a stab at not answering it and see what happens.
Oh, God. Or just write down how much it costs. Anyway, okay.
I think if I were her, I'd call the Medi-Cal worker and ask what they're getting at by that question.
Okay.
Well, I'm wondering if it's because I had a family that was trying to get institutional deeming, and they made them go through the regular process of applying for Medi-Cal first. Because
Yes, and remember I said that.
But
in order to...
Oh, well, I was off the call for a while, so I couldn't...
Oh, no, I
had
just
to get
said
off.
That one of the first steps to applying for a waiver is to
Okay.
apply for Medi-Cal.
Right, okay.
So, yes, it would require a family to apply for Medi-Cal first.
Right, okay.
Then enter into the waiver process.
Turns out you can't get onto this call with Firefox. You have to use Safari, so
I found that out, too, the
getting
hard
help.
way earlier today. I tried to experiment. Okay, any final questions?
Kathy, thank you so much. This is so helpful.
You're welcome, Juno.
Yes, thank you so much, Kathy.
I am going to correct that one slide. I'll send them off to Tara, who can disseminate them. I can work on finding out how many are in hospitals waiting or how long the average time is on the waiting list if you guys would like. It'll take me a little while to get to that information.
That would be
Yes.
great. Yeah.
Okay.
Okay. Thank
Everyone.
you very much.
All right,
Sending
thank
out,
you.
Kathy's PowerPoint slides afterwards.